Good afternoon. My name is Greg Lopez, and I come before you today to share with you the unfiltered truth of what is really happening in Colorado. You know, if someone would have told me in January that in March our world would be turned upside down, I never would have believed it. If they would have told me that in June we'd be wearing masks and we'd be doing social distancing and businesses would be closed, I wouldn't believe it either. You see, in March, the people of Colorado were asked to drastically alter their daily activities and quality of life that we once enjoyed with our family, our friends, our neighbors, and our communities. And this request came from the health officials, the so-called experts, better known as the Colorado Department of Public Health and Environment, who are reacting to the pandemic. Their initial reaction was justified, as little was known about the coronavirus. However, it's been over 100 days since Governor Jared Polis declared a state of emergency, and we are still being asked to alter our way of life. It's been over 100 days, and still the people of Colorado are not allowed to fully re-engage with our family, our friends, our neighbors, and our communities. And the question we should be asking is why? You see, hundreds of thousands of Coloradans are asking, why are we still under a state of emergency in Colorado? Is it because we are truly in a pandemic? Or is it because of some other reason? Could it be because there is a dark agenda that needs to be fully implemented? For the next several months, I will be coming before you on a weekly basis to share an alternative perspective about what is happening in Colorado and responding to Governor Polis's weekly updates on the coronavirus and other issues. I say the next several months because based on the executive orders being issued by the governor, it appears he intends to keep Colorado in a state of emergency until the end of the year, if not longer. As you know, it was just on Friday that he extended the executive order of the state of emergency for another 30 days. So we will be in a state of emergency here in Colorado until July 19, 2020. Here's a prime example of what I mean by a different perspective as to what is happening. You see, the executive orders are not laws. They are executive orders. Notice how they're called executive orders. You see, executive orders are not laws because they're not approved or voted on by the Colorado legislature, which is the only official governing body that can make laws. Why is the governor not allowing the legislature, our elected representatives, to have a voice as to what should occur in Colorado? You should ask yourself that question. So in short, these executive orders are not laws, as they can easily be terminated. This is a little known fact. Now, hundreds of thousands of small business owners, community leaders, moms and dads are starting to question the data surrounding the coronavirus that the governor continues to mention he is using to protect the spread of the coronavirus in Colorado, and rightfully so. Here's a prime example. Saturday, the Colorado Department of Health and Environment and the Colorado State of Emergency Operations Center web portal, under the COVID-19 hospital data section, the data shows that as of June 20th, 2020, the number of patients currently hospitalized for COVID-19, confirmed COVID-19, is 151 patients. Now, the critical care ventilators in use is 288. Total critical care ventilators available is 1,093. Now, how is it possible to have 288 critical care ventilators in use when you only have 151 patients currently hospitalized? How is that possible? Sure doesn't seem to add up, does it? Why is the governor listening to the director of the Colorado Department of Public Health and Environment and the Board of Health, which he appoints, by the way, instead of listening to the science and the data? Why is that? Remember, You remember the big concern that hospitals did not have enough ventilators? Well, the data shows that we have 805 critical care ventilators available. The web portal also shows that only 3 facilities anticipate ICE bed shortages and only 2 facilities anticipating a shortage in PPE. And yet, Colorado is still under a state of emergency. The numbers do not justify the continuation of a state of emergency, and hundreds of thousands of Coloradans are starting to see it. In mid-March, hundreds of thousands of businesses are ordered to close across the state, except for those that the governor or mayor has deemed as essential. Millions of Coloradans are asking, how is it that marijuana dispensaries and liquor stores, which are typically small businesses, are considered essential, yet the owners of hundreds of thousands of Coloradans that own restaurants, barber shops, nail salons, frame shops, fishing gear, jewelry stores, who rely on their businesses as the sole source for providing for their families, are told they are non-essential and must close? The resounding answer to that question is that it's not right. It's not fair. It doesn't make sense. And it is wrong. And it continues to be wrong. As the former director of the United States Small Business Administration in Colorado, I know for a fact that the closing of over 300,000 small businesses across the state has severely negatively impacted the well-being of over 500,000 Colorado families that are supported by those small businesses and the communities where they are located. Furthermore, 30% or 90,000 of those small businesses will never open again. And for those that are attempting to adhere to the burdensome restrictions placed upon them by the Governor Polis executive orders and the enforcement of these orders by the Colorado Department of Public Health and Environment, will cause the complete closure of tens of thousands of additional small businesses in the coming months. As a small business owner, I know firsthand that most people are under the false understanding that small businesses such as restaurants, bars, barbershops, salons, and others will be fine now that they are allowed to be open. That is not the case. What the general public struggles to understand is that being open is not the key to success for small business, or any business for that matter. The key to success is customer counts. Small businesses need the volume of customers to generate the necessary revenue to pay for all the costs associated with running their businesses. I also know that most people have no idea what the margin of profit that most small businesses operates under. The margin of profit for most small businesses is anywhere between 6% to 11%. That means that for every $100 of sales, the potential profit is between $6 to $11. That is why customer counts are important, not the fact that your front door is unlocked and you are open for business. When a restaurant owner is told that they can only allow up to 50% of the total occupancy capacity with a maximum of no more than 50 people, it's like telling the running back of the Denver Broncos that they can only use one hand to carry the ball because the other hand is going to be tied behind his back, and that he is still expected to score a touchdown, and he better not fumble the ball. It can't be done. It just can't. Or better yet, imagine your boss coming to you and telling you that you have to take a 60% pay cut if you want to keep your job, and he expects you to continue to pay your bills with only having 40% of your original income. It's impossible. That is the challenge that small business owners are facing today. As a former mayor I also know firsthand that counties and cities are struggling to maintain the level of quality of services they have been providing to their citizens of their respective communities due to the lack of sales tax revenues. It is virtually impossible to provide adequate community services like street repair, park maintenance, code enforcement, emergency services, and responding to police assistance when you have lost 60% of your revenues due to businesses being closed. It will take 5 to 7 years for Colorado communities and small business owners to recover from the ill-advised executive orders of the governor. It is time to open Colorado now with no restrictions and allow Coloradans to once again re-engage with their families, friends, neighbors, and communities. It is time for small business owners across the state to say enough and reclaim their lives. They need to do this for the betterment of their families' well-being, the well-being of the families of their employers, and the well-being of their communities. I ask you, if not now, then when? The impact that the coronavirus is having on the urban corridor, which is Denver, Arapahoe, Jefferson, Boulder, and Adams, is different from what is happening throughout the rest of the state. There are communities that have little to no active coronavirus cases that are shut down because of what is happening in the urban corridor. It is time for county commissioners and city council members to take the necessary actions to ensure that they are making the decisions that are in the best interest of their communities, and not allow unelected bureaucrats like those working for the Colorado Department of Public Health and Environment to dictate the day-to-day behavior of their communities. Some counties have taken their elected responsibilities seriously, and as the elected officials of their community, they have reopened their cities and counties, such as Weld County as an example. Now, county commissioners and city council members are empowered, and they need to pass ordinances that will allow them to issue business licenses, liquor licenses, and any other license that the state may threaten to take away from businesses within their boundaries if they do not comply with the governor's executive orders. These elected officials have the authority to do so, and it just takes courage to make it happen. The first ordinance that all counties and cities should pass is that wearing a mask is optional and not mandatory. Here's why I say this should be the first ordinance. The World Health Organization and the Center of Disease Control and Prevention have conflicting positions on the wearing of masks. The WHO mentions nothing on the wearing of masks to prevent infection and or to slow transmission of COVID-19. And the CDC states that wearing a mask may, it doesn't say will, prevent the virus from spreading. The CDC goes as far as to say that is only when the infected person coughs, sneezes, or talks. So I guess what they're trying to say is don't cough, sneeze, or talk from now on, because you could be infected and you could be spreading the virus and not know it. So as much as both organizations would like to claim that they are the experts on controlling the spread of COVID-19, it is clear they are not in agreement and they truly don't know what to recommend. So under this premise, masks will never go away. Do you want to be the one telling stories to your children that there once was a day in Colorado when people did not wear masks? I don't want to be that person. So again, when will the masks go away? The answer is never. Have you ever noticed how the masks are becoming a fashion statement? People are buying all kinds of designer masks. It is wrong for the governor to encourage business owners to refuse service to anyone that is wearing a mask. Why should the governor want businesses to openly discriminate against individuals who understand that the mask does not prevent the wearer and there is no conclusive evidence that it will help protect others from getting the virus? I want you to think about something. If masks prevent the spreading of the virus, then why have the medical experts not recommended in the past years to wear masks during the flu season? In early May, the CDC released its final influenza surveillance report for the 2019-2020 flu season. Between 39 million and 56 million people were sickened with the flu this flu season, which ran from October 1 of 2019 to April 4 of 2020. And you never heard anyone speak about wearing a mask to prevent the flu from spreading. Think about that for a minute. I think you might know why they didn't make that recommendation. Social distancing is the same false narrative. The CDC states that the best way to reduce the spread of the coronavirus is limiting face-to-face contact with others. They even have a picture on the website with two individuals wearing a mask and still doing the social distancing dance. So which is it? If the masks work, then why the need for social distancing? If social distancing and limiting face-to-face contact works, then why the need to wear a mask? It is clear. The science has yet to truly figure out what people should be doing or not doing. Everything that people are being asked to do is to flatten the curve or reduce the spread, but have you noticed it is not going to stop the virus from spreading? So what does it mean? It means everyone will eventually get the virus. So, in closing, I want you to remember these 10 things. The best solution for fighting the coronavirus is herd immunity. Infectious experts, so-called experts, have no answers. The coronavirus data does not support a state of emergency status. The governor is overstepping his authority by keeping Colorado in a state of emergency. Executive orders are not laws. Millions of families and thousands of businesses are being permanently harmed. We need to open Colorado with no restrictions. The ability for counties and cities to provide public services are being impacted. Counties and city councils need to take bold actions and help small businesses survive. And last, masks and social distancing don't stop the spread of the virus. They simply don't work. So, I want to thank you for being with me this afternoon. And until next time, remember, it's about all of us, not just some of us. May God bless each and every one of you.